And welcome back to the marketplace. Drone logistics are increasingly transforming healthcare, improving access to vital medicines, enhancing system responsiveness, and saving lives, particularly in maternal and emergency care. A recent study by Zipline Ghana and the Ghana Health Service revealed a 56.4% reduction in maternal deaths at facilities served by the drone delivery system. Earlier in the week, I discussed this groundbreaking development with Daniel Kwekumaki, country lead for Zipline. Thanks for being with us, Daniel. So let's talk about how the drone delivery model has reshaped healthcare delivery, particularly in rural areas and hard-to-reach areas.
The way our health system is built, right, it just enables us to really go into any area irrespective of the healthcare access. And it even helps us in terms of building out the infrastructure, because you don't need to replicate a full-fledged infrastructure in each little rural, let's say, CHIPS compound. What you can do, you can really store the commodities centrally, and then the doctors or the nurses can order and receive the commodities within, let's say, 30, 40 minutes afterwards. So what it really does is it brings that equitable health access across the country into any island, into any mountainous areas, across bad roads. And then the next thing is that this is a holistic infrastructure. So it actually at scale has a lot of cost efficiencies. I mean, you think about a CHIPS compound and you having to have like a certain infrastructure that you built out there. Instead, you can just centralize, have like top-notch warehousing systems and then deliver. So what I would say is it has given like reduced missed opportunities to treat or vaccinate, has had real impact in avoiding deaths. And it also has the advantages in terms of, let's say, a pandemic, in how you can respond to that.
Yeah, I want to dig in on a recent study by which shows that 56.4% reduction in maternal deaths at facilities served by Zipline drones. Can you walk us through what this statistics means in real human terms?
Okay, great. I mean, first, just to give the context, I mean, the study was done like comparing health facilities that had access to Zipline and the ones that did not have.
Yeah.
So that 56.4% reduction in rate is comparing health facilities served by Zipline versus non-Zipline facilities.
Okay.
And of course, I mean, the death statistic speaks for itself. But then what is maybe more surprising is when you look at the effect on the health system generally, because what we notice is that one of the reasons why the mortality rate reduced, aside of the access, is actually that once the patients realized that commodities are readily available, it changed their behavior. So we had like a 20% increment in antenatal visits and a 25% increment in hospital births.
Right.
So it actually changed patient behavior, and you could do that at scale.
Yeah. So, I mean, beyond maternal health, how is your technology influencing healthcare?
I mean, firstly, also our technology could actually go beyond healthcare. Right. But in Ghana, of course, a lot of what we are doing is currently healthcare. And I would say, for instance, there was a study in the Western North in terms of immunization. There we had like increases in immunization rates between 13 to 37% for facilities that were using Zipline. So even there, you could see like similar effects in terms of just an increase in the utilization of the beneficiaries. But then you can also reduce the waste with such a system. Because for instance, like, you imagine you are having a truck and you drive like a few vaccinations across the roads to like a small CHIPS compound or a small hospital. Number one, it's very ineffective, both in terms of time and cost. But number two, it is also that you send a package there, there is a higher wastage. If you store it centrally, you can reduce the wastage, and there is a lot of accompanying benefits that you can get when you operate this like with a clear vision, which would be, of course, that's the joint undertaking we are doing with the Ghana Health Service with Ministry of Health.
Yeah, can you talk to us about the partnership with the Ghana Health Service, how you're collaborating to integrate services when it comes to national healthcare systems?
I mean, we are working very closely with them. Even the study that we are talking about is done with the Ghana Health Service, the maternal health study that we are talking about. And of course, these commodities, they are distributed by Ghana Health Service through the medical stores. So we collaborate closely with them for us to have them in our 6 warehouses. And I mean, I've spoken earlier a little bit about the impact, but when we put it holistically, in Ghana, we have done more than 700,000 deliveries. We have delivered more than 60 million doses of vaccines. So I think that in its own shows the scale. But I also think that there's far more that we could do if we could really utilize the infrastructure to its fullest, like data optimization, ensure that the deliveries are we really use it for the most high impact deliveries. And we think from the whole system top down on how best do we utilize that infrastructure that exists in Ghana at this moment in time to really leapfrog like older systems.
What are some of the key learnings from the partnership?
Some of the key learnings, I would say, I mean, number one is really like that integration is key. And that integration has to happen both from top up and from the top down. So I think that is definitely one of the key learnings. And then other key learnings is just the effects that we can have on health outcomes, which, of course, as a company, we were convinced about the positive effects that it would have. But then things like what I pointed at in terms of changing customer behavior, having like reduced wastage. So those are the major insights that we gained.
Yeah. So what's next for Zipline in terms of scaling this impact?
I mean, right now we have 6 distribution centers in Ghana covering, I would say, around 75 to 80% of the country. So of course, one goal would be to be able to cover the whole country to really have that impact. But I think the other thing, when you look at the successes that we had in some region and places, like highlighted in the Ashanti region by the maternal health study, in the Western North by the immunization study, it would be to replicate this across the country and then have like really ambitious goals together with the Ghanaian government, in which we can transform the blood supply chain, in which we can really have like 0 missed opportunities for kids across the country. And I think with this technology, if we really integrate and we have like a vision that is driven by the government with Zipline as a technology provider, a technology company that can help on the data front and in many other aspects, then we can have that world-class health infrastructure across the country.
Are there any new technologies or innovations in the pipeline?
Yes, I mean, the technology that we are deploying in Ghana currently is like a technology that is geared towards the rural areas. So basically, when we have a distribution center, we can serve like a radius of, let's say, around 110 kilometers. So, and then it's like, I would say, a high-low-tech combination. When you see our drones, they're relatively light. They drop off via a parachute, just to quickly put that in context. Now, in terms of new technologies, one of it that we are currently deploying is like an increase in package size, which gives a lot of new opportunity for us. And the other one is we have a new technology that is more geared towards urban settings. So that one, we are currently rolling it out in the US. And as I said, it's like for shorter deliveries, a different technology. It has like a larger drone that hovers and then zips down like a smaller box, which does the delivery. And then that has reverse logistics capability. It has pinpoint accuracy versus the current system. So that means that we could also expand into cities and have other business, infrastructure, healthcare opportunities there.
Well, generally, my last question, what do you see as the future of drone logistics? What are the potential threats right now?
In terms of the future of drone logistics, personally, I'm an entrepreneur. And as an entrepreneur, what you see is usually somebody has to build the infrastructure, whether that is the internet, whether maybe like right now, we have companies in the US, SpaceX going into space and building out, and maybe 10, 15, 20 years later, people build their systems on top of it. So I'm looking at it as the same way. This is an infrastructure with which we can democratize access. There's many more opportunities from artificial insemination in the agriculture space. So I look at it as we are building that infrastructure. And then afterwards, if we build this out in Ghana, Ghanaian entrepreneurs can find solutions, can push their companies forward, and really provide equitable access to their products, their solutions, irrespective of whether you live in a city or in a rural area.
Daniel Kwekumbeki, Country Lead Zipline, thank you so much for joining us.
Thank you.